Hello, good evening, and welcome to Iron Port here on Metropolitan Television. Iron Port is proudly brought to you in association with the Ghana Revenue Authority, Goil Company Limited, Serene Insurance, Ghana Link Network Services, Meridian Port Services, and indeed, it's powered by the Ghana Ports and Harbours Authority, GPHA. Now, we are streaming live on our social media pages. On Facebook, we are streaming live at Ghana Ports and Harbours Authority. Ghana Ports and Harbours Authority. Still on Facebook, we are streaming live at Port of Tema. On YouTube, we are streaming live at Iron Port Ghana. Iron Port Ghana, our media partner on this journey of a lifetime, as usual, is the Business and Financial Times, the BNFT. And so if you want to have a grasp of all that's transpired in the show tonight, make a date and grab the Thursday edition of the BNFT. And you'll be able to see all that happened here on the show. As usual, we're getting interactive with you. And so all you can do is to send us your messages and comments ahead via our dedicated WhatsApp line, which is 0559019177. 0559019177. At the appropriate time, when I pick signals from our production team, we shall activate the phone lines for you to call in and contribute to the discussion. My name is Kennedy Mona. We're going for a quick break. When we bounce back, we continue the show. Please do stay with us.
Every now and again, Goil makes good things happen. This time, Goil has introduced Super XP Ron 95, a higher grade fuel loaded with additives and yet sold at the same price as normal fuel. Goil Super XP Ron 95 enhances engine performance like never before. It maintains the engine by keeping it clean from carbon deposits. Goil Super XP Ron 95 is designed to burn slowly and thus improves fuel economy, making you save money after several kilometers. Goil Super XP Ron 95 gives you a smooth driving experience, that is, less vibrations. Fill up with Goil Super XP Ron 95. Now there's no need to pay more for any higher grade fuel. Goil has that sorted. Goil, good energy.
Electricity, then pay your taxes. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Tell God, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Impressive factory. If only I had listened to you, I wouldn't have been in this mess. That devastating fire virtually wiped out the whole factory and my warehouse.
Remember my misfortunes last year? Serene Insurance Asset All Risk Fire policy that I took were there to pay for my damaged stocks in the warehouse. And my machines that were affected by the floods have been replaced. My accident vehicle is back on the road thanks to Serene Insurance motor policy. Currently, my goods are on the high seas covered with their marine cargo insurance policy. I was just telling Ajima about Serene Insurance.
Oh, Ajima,
tell him more.
As a road contractor,
I make sure I do my contractors all risk insurance
for the projects and then workers' compensation for all the workers on site. With Serene Insurance, they will make sure they will cover your unknown tomorrow today.
Serene Insurance, a new face of insurance. Call us now.
MPS Terminal 3 is Africa's new state-of-the-art container terminal at Tema Port. For manufacturers, agro-processors and traders, the new port means business can be done faster. This infrastructure boost will improve Ghana's port handling capacity, connect more trading routes, and oil the engine of growth for the economy, creating greater opportunities across all sectors as Africa's markets merge and become the largest trading bloc globally. MPS, we connect, you thrive.
All right, so you're welcome back. It's now time for us to take a look at happenings in the port and shipping industry in the course of the week. And just this week, the Ghana Port and Harbours Authority and ACVL have begun the piloting of the truck and trailer identification and inspection policy, which is going to be rolled out pretty shortly in the course of the week. Plus the fact that they didn't know that the Ghana Port and Harbours Authority has a choir. All right, so tonight you'll be unleashing some songs onto you from the GPHA choir. Please enjoy.
The implementation of the truck and trailer identification and inspection policy at the Port of Tema is currently in its pilot stage, ahead of its implementation in August. The truck and trailer identification and inspection policy is being rolled out to ensure that haulage trucks using the port are identifiable and in good condition to carry cargo. As such, all trucks that use the port for hauling of cargo are expected to register with the port for access and verification. As part of the pilot program, selected security officials who represent the monitoring team to inspect vehicles have undergone a 3-week training on the port loading radio frequency identification, also known as RFID, that would be used to verify trucks registered with the port. The security staff underwent both theoretical and practical training on the use of the RFID systems for access control. Bafwe J. Mensah, Director of Operations at Auto Consults Ventures Limited, the authority's technical partner, said the ultimate goal of the program is to encourage an appropriate maintenance culture.
The port load safety program, or the port load worthy program the port is initiating through ACVL, or have contracted ACVL to do on their behalf, is to register all the trucks that operate in the port or that wish to operate in the port. We identify them by tagging them with RFID and keeping all their data in one system for verification at the gate. And we also conduct port load safety inspections on them. The inspections to ensure that the components of these haulage trucks that they use in carrying cargo, that is their twist locks, their fifth wheel, air hose, connection for brakes, lights, are all present and they are functioning properly. That the component that secures and carries cargo are present, are functioning properly. You know, the truck carry loads, work, do evacuation, that's a lot of things, and there are wear and tears on the truck. So what this project hope to achieve is that it inculcates the culture of appropriate maintenance so that these truck owners and drivers will keep their maintenance schedules on a high.
He said both GPHA and traders stand to benefit substantially from the policy.
When these trucks that are carrying the cargoes are in good conditions, one, cargoes will also be in good conditions. Lives and properties in the port will also be safe, because accident rates in the port based on these components that are not functioning will be drastically reduced. Traders in the port, they can now be assured that since the trucks that are carrying their cargo that they have imported or are exporting, these trucks are in good condition, so they now can be assured that their cargoes will reach their destination safely. And these accidents, as I said, that have been happening will be drastically reduced.
Music, and I say, enyom to, ema sunsu, ekanya sunsum, enyom to, ema ayrechichi, enyom to, ema yarisa. Inti gapo akwa, yejina ha omban no.
Dale, Authority, yeah. For those Asomdwe, Ayenya Uto. For those Asomdwe, Baba Bebe. For those Asomdwe, Ayenya Uto.
All right, so that was a song, a small rendition, a very short rendition of a song hinged on peace and unity, from the Ghana Port and Harbours Authority choir. Indeed, patriotic it has been. You can reach them in the port community of Tema, and then they can come and then do justice to your events. All right, so we'll go globally and find out what's happening in the port and shipping industry.
The UK government is moving forward with its new legislation that would require segments of the shipping industry to pay seafarers at levels at least equivalent to the UK national minimum wage. Seen as a political response to P&O Ferries' mass firing of crews in March 2022, replacing them with contract workers, the shipping industry, however, remains critical of the draft legislation, saying it has gaps and could negatively impact other parts of commercial shipping and port operations. The draft of the Seafarers' Wages Bill received its first reading in the House of Lords on July 6 after being announced in May during the Queen's speech that sets the priorities for the new legislative session. The draft focuses on vessels and services that call at UK ports at least every 72 hours on average, or more than 120 times a year. Vessels meeting these criteria would be subject to the requirements. This is an attempt to narrow the legislation so as not to cover the broader commercial shipping industry, but it is unclear if it would cover vessels such as commercial fishing boats that operate from the UK. KVH, a global leader in mobile connectivity and inertial navigation systems, has rolled out the world's first satellite, cellular, and Wi-Fi hybrid network service with one single terminal on board. The service includes KVH satellite coverage on the Intelsat network with speeds of up to 20 megabits per second, plus integrated 5G LTE cellular service in 150 countries. The terminal has an integrated Wi-Fi bridge for extra cost savings and speed when alongside the pier. Some vessel operators and service providers have worked out their own hybrid VSAT 5G solutions before, but this is the first service and hardware package to integrate all three with a single invoice. According to KVH, they are introducing a new standard for integration, convenience, speed, and affordability for commercial seafarers and leisure boaters worldwide. With the Iranian nuclear talks seemingly going nowhere, along with efforts to improve the Iranian oil trade, the U.S. Department of the Treasury's Office of Foreign Assets announced a new wave of sanctions on companies and individuals, as well as 2 vessels, all tied to the trade in Iranian oil. This comes as the U.S. also remains in a dispute with the Iranians via the Greek courts over an oil shipment on tankers that was sanctioned in February 2022. According to the announcement, the sanctions targeted an international network of individuals and entities spanning from Iran to Vietnam and Singapore that has used a web of Gulf-based front companies to facilitate the delivery and sale of hundreds of millions of dollars worth of Iranian petroleum and petrochemical products to East Asia. U.S. authorities said the network had conducted significant transactions for the sale and transport of petroleum products from Iran dating back to at least November 2018.
All right, so you're welcome back. Those were happenings in the port and shipping industry on the international stage. It's now time for us to zoom into our discussion proper tonight. And tonight we're taking a look at the COVID-19 pandemic and the role that some of the health facilities played, during its peak in 2020. We are putting the spotlight on the International Maritime Hospital, IMaH. It's a subsidiary of the Ghana Ports and Harbours Authority. Now, we all saw how the pandemic ravaged our country and how we were able to contain it and how we raised, we got a lot of our counterparts across the globe kind of like praising us for the manner in which we handled the pandemic, the manner in which we tackled it. Now, one particular facility that served as one of the referral centers in our country was the International Maritime Hospital. recently we've heard news about the resurgence of the pandemic and some of the figures going up and all that. And so we just want to take a look tonight at the role that IMaH played during the 2020 pandemic and what it's still doing currently to contain the numbers that troop there on a daily basis. And so I'm glad tonight to introduce to us Dr. Akwesi Acheampong, who is the Chief Executive Officer of the International Maritime Hospital, IMaH. Doc, good evening and welcome, sir.
Good evening, mate.
Also in the studios with us is Dr. Barbara Cabo. Dr. Barbara Cabo is an emergency physician and head of the IMaH team at the international, head of the COVID team at the International Maritime Hospital, IMaH. Good evening, Doc, and welcome.
Good evening, Ken.
Let me say Happy New Year to you all. We have a tradition here. Once it's your first time, we'll say Happy New Year. And
Happy
welcome
New
to our
Year.
import. Absolutely. Yeah, so let me begin with you, Dr. Cabo, and find out, tell us the role you played when COVID first broke at IMaH and some of the things that you did to support the country's quest to contain the pandemic.
As an emergency physician, when COVID started breaking out, not even in Ghana, I anticipated that whatever we do, we'll get COVID coming through the emergency. So I prompted our CEO or the management of IMaH, and then with the help of GPHA management, we put in some strategies to set up a COVID ward and a COVID monitoring team. That's to start early testing. And luckily for us, GPHA they were very willing to get us the equipment we needed, and then the medication. Some of them were not even in the country. They helped us procure those medications. So at the beginning, we've had good success rate with COVID because we started testing earlier. We had a policy. Once you are in the emergency, whether for COVID-related illnesses or not, we'll test you for COVID.
Yeah.
So we ended up getting the people who had COVID without symptoms and treated them earlier before it got worse. Those was where we got our reputation for having good success rates because we screened everybody through the OPD and in the emergency for COVID. And I think it helped us catch COVID, I would say, in infancy before it went out of proportion.
So what would you say were some of the things that you did that culminated in the selection of IMaH as one of the referral centers in our country?
Ghana, we anticipated that if we had a lot of severe cases, we would be overwhelmed because we have limited ICU spaces. So one of the things that made IMaH stand out was we had improved and expanded on our critical care service for COVID patients. So we were one of the out of 4 hospitals in Ghana that was taking critical COVID cases. And I think it set IMaH apart.
Okay. So you caught the attention of the health authorities and they singled you out as one of the referral centers.
For very severe cases.
Right. Great. And so how would you say your success rate was in terms of managing the pandemic and managing patients?
I would say our success rate was very high. We treated over 1,000 COVID patients, but only 500 were actually sick enough to be admitted. And out of the 500, our mortality has been less than 20 compared to other hospitals. Because we were very aggressive in our management. We didn't hold bars, so we went in guns blazing. So we had very good success rate. At some point, our success became a problem because we're overwhelmed with cases.
Because everybody wanted to refer there.
Yes, please.
Yes. All right. So tell me, did you have occasions where some of your staff, some of your colleagues, the paramedical staff, kind of like also got infected in the course of helping others?
I would say by the grace of God and following our infection prevention protocols, we've had only 2 staff get COVID from 2020 till now.
Wow.
So because you are treating COVID patients, you can see how sick they get. So everybody was extremely cautious, and management also enforced the hand washing, nose mask wearing among the staff and patients to the facility. So I think it reduced the infection rate among the health workers in IMaH.
Right. Okay, I'll be coming back to you and to find out what the current situation is, because we understand there's a resurgence and there's an upsurge in the numbers and all that. So we'll be coming back to you to find out what this current situation is at the place. But let me come to Dr. Acheampong. Doc, you have just assumed reins of a CEO of IMaH.
Yes.
What are some of the systems you came and met, and what are some of the subtractions and additions you are making?
Well,
these systems, if you are making any, anyway.
Sure. One of the good things that IMaH did, or my previous CEOs and management did, with the help again with the GPHA, was producing our own oxygen. I mean, I think Dr. Cabo, mentioned how well IMaH handled the COVID. But in the COVID treatment, as we all saw, oxygen was a critical part. So IMaH, we had our own system that we are producing oxygen. So we always have sufficient oxygen to the point whereby we also, selling it to other hospitals or giving to other hospitals.
Right.
On that sector, what we have done is that as COVID was about to, surge, we decided to have excess oxygen available. Right. Therefore we don't run out of oxygen. Because it's very, very crucial. That's one thing. The other thing is that when we took over, IMaH has been here only for 5 years.
Yeah.
So within the 5-year period, the previous CEOs and management did very well. Put IMaH in its pedestal now, as we are talking about. So my duty is to build on what they have already done, and so far I think we've done very well. One of the things that when I took over that was concerning, all the complaints that we are having, people were complaining, not the service, but at times the way we interact with patients, the way we interact with people that we provide service to. So we decided to look into that critically, that even though I'm sick, I need a care, not only medical care, I also need psychological care, I also need loving, tender care. So we decided to build on that, and that has helped us significantly. Because as you know, as a physician for many years, even if I go to see my own doctor, I get nervous.
Right.
Okay. Even if I see a white coat, I get nervous. So the patients or the clients, as we call them now, they are already anticipating some nervousness. So it is our job as providers to ease that nervousness. So we have to encourage everybody that they are here as clients, they are here to ask our services or for us to provide something for them, especially their health. We also have to look at the whole human being totality as a holistic approach. Not only high blood pressure, diabetes, take medication, but you have to have a holistic approach, starting from respecting me as an individual, and secondly, be able to serve my needs. And that is what we are aggressively looking for and trying to resolve that at the moment.
Okay. All right. Let me come to Dr. Kabu and find out from you. I said I was going to ask you what the current situation is like at IMaH in terms of COVID numbers.
As of 2 months ago, we had technically closed our COVID ward because the cases were more like mild, so we're seeing them through the OP, the outpatient department. But 2-3 weeks ago, we had an influx of COVID cases again, so we had to reopen the ward.
Right.
So currently, as I'm speaking, since 2 weeks, we've managed almost 30 inpatients.
Right.
So, and then right now we are realizing that there are more kids being affected than children. Previous waves, we had more, you'll see 1 or 2 kids, pediatrics coming. But of late, every week we have a pediatric case as young as 2 months.
Wow.
Yes, with COVID, very bad COVID infection. So we still keep on preaching to people the prevention methods. If you are an adult and you have a kid, you may wear the mask. You forget that the child was not wearing a mask, and they can get it. And usually, when kids are sick, it breaks everybody's heart. Like Absolutely. It's so disrupting. So the COVID numbers have gone up again. We are seeing more cases of the COVID at the emergency, and then we are doing more COVID admissions.
Right. Right. Okay, so have you had instances where people voluntarily walk in and say, I suspect that I am positive with COVID. Please give me a test.
Yes, please. It's gotten better. From 2020, nobody wanted to be diagnosed with COVID. So people who are even dying, they didn't want to be tested. But now people know that it's better to get tested and get treatment early. So we do have people who come into the emergency or the OPD. They have symptoms. Sometimes it's just anxiety. I will test and it's negative. So we do provide that service too.
All right, just on the lighter side, we understand there were some people who also took advantage of it. Workers, took advantage of it and would walk to Dr. Barbara's desk and say, Doc, I am fine, but I just wanted to, give me a document that shows that I'm COVID positive so that I can get some 2 weeks quarantine at home and do my stuff.
Oh, I would say because of our clientele, we have a lot of expatriates, so we try to do everything above board.
Absolutely.
Because I don't know where you're going to send this thing for.
Yeah.
So we try to do everything above board. If you are not sick, we wouldn't write any document to say you are sick.
Right.
And then maybe if I say you were sick and I write that document to cause fear and panic at your workplace.
Yes.
because you've exposed your colleagues, which technically isn't true. So
Yes.
we try to do everything above board when it comes to COVID testing.
Okay. All right. So tell us about the number of cases in general that you've handled from 2020 till date.
We've
If
had
you have the numbers, yeah.
510.
Okay.
Yes. Not in addition to this week's number. I didn't
Right.
get this week's number.
510 from 20 to
2020 to
okay. Active or active like
as in cases we've treated and
yes.
discharged.
Yes. Okay. All right. Great. Let me come to Doc, and just want to. I'm so inquisitive because when you walk about in town, a lot of people say a lot of good things about IMaH. I mean, world class, international standards, and all that. What is it that sets IMaH apart?
Well, that's very simple. The planners of the hospital actually thought about certain things, and then they want to make sure that IMaH doesn't become any ordinary hospital or any ordinary clinic in Ghana. So one, they thought of having one-stop shop, meaning that once you come there, everything you need is there. And also they put up, some professionals, that well-trained and pull them from different facilities, and put them together. So it became an easier thing because it's a concept that they wanted to promote.
Yes.
And then it was easier once somebody gives you the concept. I remember when I was interviewed for the job, they asked me if do I know the motive, how the IMaH was established. And godly, thank God for that, I already researched it. So it was much easier for me. It's one-stop shop, and therefore you had to make international. If you look at the name, International Maritime Hospital, the international here means international standard. So they want to promote healthcare, because see, if you go to most hospitals or most clinic, the treatment that you get is really not optimal. Okay, so, but IMaH, because they want international name, they wanted to create that. And as my colleague, Dr. Cabo said, we serve expatriates. Okay, we serve the seafarers. Now, seafarers are coming from overseas. They have some standards, some expectations. So can we meet that? So the builders thought of it that way, which is the GPHA thought of it. Can we meet that standard? So that was how IMaH was built. If you look at the buildings, you look at the rooms, you look at even the environment, it is equivalent to any hospital in the world. I mean, I've been to so many hospitals in US. If I blindfold you and put you in IMaH, and I tell you in any New York hospital, you believe it. That is the standard that they want, and I think so far we have achieved that. If not, we have almost achieved that, and I think it's a good thing that the IMaH set up that way.
Now, most of the people that seem to be the bourgeoisie, like the elite, and so it gives people the impression that this hospital, we cannot afford it, and so we better not dream or even think of going there. Is that really the situation? Is IMaH, really for only the elite in our society?
Well, that is one of the myths, that IMaH is only for the elite. No. I mean, our price is comparable to most of the private hospitals in Tema or Accra. It may be a little bit above, simply because our cost unit is higher based on what we have, the environment that we have, but it's very compatible to, I don't want to mention any other hospital name, but it's very, very compatible. The reason why people thought it was for elite, one, our location, and two, because it was owned by the GPHA, which another myth is that it's only GPHA workers that comes to IMaH, which is not true.
That was one of the questions I was going to pose to you.
Okay, this is a question I get all the time. So that, is it only for GPHA employees? No, it's not. And therefore, but they build it in such a way that anybody that comes to IMaH will get GPHA's care, which is that the top of the line. But it's not for the bourgeoisie, so it's not for the elites, it's for everybody. And if you can't afford, then you have to approach the management team, and sometimes we can see how
discounts.
Because see, it's not all about money, it's about giving a care. Some people will come, they have no money, but they are in a critical situation. Before they can even put money there has to be some caregiving. And Dr. Cabo will tell you, she sees patient in the emergency room because the patient is critically ill. and the patient is brought by ambulance, you're not going to ask for money. You have to stabilize the patients first. You don't know whether the patient can afford or not, and that's what she does. She treats the patient first. Okay, so that is the modality that treats patients first, and then you worry about the other point later. However, if you also have money you can afford IMaH, of course, we are more than happy to have you. But the key thing is that anybody who wants to come to IMaH is welcome.
All right. Let me come to Dr. Kabo. Doc just mentioned the fact that, yes, sometimes we've had instances in our country where people die as a result of the fact that they arrive at the emergency and they say, put some money down before we attend to you. And in the course of the meal, in the course of the brouhaha, then the fellow passes on. And so sometimes you don't necessarily put the blame on the facility because they are principles and regulations they work with. And sometimes when you give it a human face, you think that, no, this should have been attended to in order to save the life before any other thing comes. Have you had instances at IMaH where people come and then it's like, okay, these are the rules, put this amount down before we begin treatment?
Usually in the emergency setting, we start the treatment, but we make whoever brought you in that there's some bit of financial commitment to it. But I usually say that we don't demand for it for up to 48 hours. We give you that time. But for the initial bits, we go all out to stabilize the person, because you never know who you are stabilizing an emergency situation. It could be your uncle. You've had cases where you stabilize and finish, and people come to visit, and you find out it's your sister's, like, it's close relation, and you be like, oh, so if I didn't do this, it could have ended badly. So we really not, even though we would want to be paid, but in the emergency situation, that is not our priority. It's to keep people alive. That's our main priority.
Great. Okay, so I just wanted to walk us, give us a mental picture. During the 2020 peak period when COVID was, quite huge, I wanted to give us a mental picture of when a case comes to IMaH, the processes you pass through from the start, once you diagnose and then it's positive. Walk us through the process.
Okay. From 2020 to now, our way of diagnosis has changed. Because in 2020, we were not testing. We didn't have the capability to test in IMaH. So we had to send our swabs to Noguchi, which would take sometimes 2 weeks. So we had to find a different way to diagnose COVID. Luckily for us, we had a very good radiological department with good CT scans, so with this chest CT, and in combination with some other labs, that could suggest it was COVID whilst we're waiting
for the actual results from Noguchi.
So we started treating. That also led to our success rate, because we didn't really wait for the results. PCR. So once you are tested, we had a COVID ward that was on the second floor. We moved there, which was purely isolated. Like, was isolated from everything else. We didn't encourage visitors. We had guidelines onto the number of people who could come see the COVID patient, just to prevent the spread to the household.
Right.
But we didn't want, if a father is on admission for COVID, everybody in the house ends up having COVID. And so we would admit you to the COVID ward. Based on your labs and parameters, there were certain treatments we would give. And if we thought you were it was a severe case, would give you certain medication. They were quite expensive, but they were very good. Like, you would see improvement in symptoms in hours. It also improved our, the success rate, to a point that the pharmaceutical company that made that drug, anytime they imported it, they always called IMaH to make sure we needed it before they sold it to anywhere else. Because they knew we were using it for good, and we were getting good rates from it, like good success rates from there. And we didn't even stop there. If you were tested and you didn't meet admission criteria, you were given a brochure on the things to look out for. That tells you that your symptoms were changing. What to do and what not to do. With a dedicated telephone number to call regarding anything of concern with your COVID treatment. And even after discharge, those who were admitted, they all had my contact number. I would tell you, call me even if it's the middle of the night. Because I'd prefer you wake me up from sleep than to not call me, and then something we had managed for days and you got better becomes worse. So we had hotlines for people who were discharged to call in when they had concerns, or even concerns for other relatives in the house. So it was more like a community treatment of COVID. We didn't just treat you and left you to your own and leave you to your own. Whether you were treated through the OPD, outpatient department, or you were on admission and discharge, we followed up on it. And when they started rolling out the vaccine, I made it a personal goal to call each and every patient that was ever admitted to ask them to come to IMaH for the vaccination.
Yes. Right. Okay, so at what stage would you recommend? Doc mentioned the fact that IMaH manufactures its own oxygen, and so you had oxygen all the time. At what stage would you recommend that a patient suffering from COVID be put on oxygen?
Usually we use what we call arterial blood gases. We check the oxygen in your blood, or we can check the surface oxygen, which is the SpO2. They will put a monitor. I'm sure people now are used to it. So can tell you how much oxygen is in your blood. So usually when it falls below 90, then we'll put you on it. Sometimes it doesn't just mean we put you on it. You can be doing 100, but maybe your work of breathing, what we call work of breathing, you are hyperventilating, breathing too fast. We use muscles to breathe.
To stabilize.
So if we don't stabilize you and your muscles get tired, you go into what we call respiratory arrest. So we sort of cut it short before it gets there.
Right.
So even you are severely ill by not just your pulse, SpO2, that's the oxygen in the blood, but other parameters. COVID, I'd say, was the junior brother of HIV. It affects every organ. We've had people with COVID blindness, COVID priapism, COVID toe. COVID, it will destroy your kidneys. So it depends on which organ it targets. We still give supplementary oxygen because if it attacks the kidney still needs oxygen. So we give you extra oxygen so that the kidney damage is subsides. And we've had people who have presented with COVID, like stroke. They came in, we were thinking they were stroke patients. So COVID can make a lot of illnesses. And it helped that we started the testing for all category of patients. Or somebody may present with stroke-like symptoms and you think it's stroke, only to find out that it's COVID. You start the COVID treatment and then the weakness resolves. And it was always amazing how COVID, I would say, was trying to play Chaskele.
It was a chameleon. Like a chameleon,
changing its mode. It stopped 2021. It changed from respiratory to GIT, as in like gastrointestinal symptoms. People will have diarrhea, they'll do ultrasound, you think it's appendicitis, only to find out it's COVID later on. So COVID, you have to be on your toes. You have to read and follow trends elsewhere. Because any trend that is elsewhere will replicate in Ghana. So if you follow trends, you anticipate what COVID will do before it even gets to Ghana.
All right, I'll come back to you. When I come to you, I want to find out from you our attitude. When HIV first broke, it was like everybody was quite afraid. And the same thing, when COVID came, everybody. But now I think people are beginning to understand it, and so they are a bit laxed. And even when you tell them to obey the protocols, they think that you are being too hard on them and all that. So I want to come back and find out from you, what do you think that we should be doing in terms of our attitude? But let me come to Doc and find out. We know that IMaH has a world-class diagnostic center that does a wonderful job, and everybody's talking about it. Tell us about it. Why is that? Everybody's talking about everybody wants to have his or her labs done at IMaH.
Well, yes, we do. Like I said, the originators wanted to have a first-class, hospital. So they put a first-class diagnostic machines such as MRI, CAT scan, mammograms, sonogram, echocardiogram. I've worked, like I said, many areas in hospitals. The MRI that we have in IMaH, I have not seen it. In even the US, it's a Tesla 3. Tesla 3 gives you a very clear pictures. That is the highest so far that is out there. So IMaH has that. Mammogram, which is also something that we need, if time permits. I probably will talk about it, but it's very important to me. Which, of course, IMaH also has that. So every test that you need.
If you can expatiate on the mammogram before we move on, that will be fine.
No, mammogram is a test that we check for breast lumps or breast tumors. For anybody, any woman. No, actually, I must say anybody, not any woman. That we check the breast to see any lumps, anything there. Why do I say everybody? Because men do have breast cancer. And I've diagnosed men that came with a breast mass, it turned out to be breast cancer. So men do have breasts, it just don't develop. If it doesn't develop, doesn't mean that you don't have it. But the way science is looking at it is that because the women develop their breasts, they want women to go check for breast cancer. Breast cancer to me is one of the cancers that you can prevent or you can treat easily. Now in Ghana here, if somebody diagnosed a breast cancer or any cancer for that matter, usually stage 3, stage 4. compared to any Western country, it's either stage 1 or stage 2.
Right.
Because we don't have the mammogram to detect it. So once you have the mammogram, you can detect it early. But you've been amazed that women don't even go and check breast exam.
Right.
Or they themselves don't do self breast exam, not alone, to go for the test. So this is where the vision that we have to have comprehensive center that you have to come. When you come, you do all these things.
Right.
So the MRI, the CAT scans, the sonograms, and most importantly, the amazing thing is the dialysis center. So all these things was put in place. But before I finish, let me go back to one of the questions that you asked. That if somebody comes in, they don't have money, what do you do? Surprisingly, since I took over, I have 2 families, one company and a family member, which the family member wants to leave their name not mentioned, so I'm not going to mention that. Right. So they donated some money, so seed money that they're going to build on every year for emergency cases. People who do come to emergency don't have the money, immediate care that can be taken care of.
Right.
Okay. Though it's not much, but it's a start. So I'm going to actually use your platform, if I can, for people to do that to other hospitals, not only IMaH. So any hospital that you think people do need service that they can't afford to pay, people should at least...
I hope with this revelation, you go and then be inundated with people coming in to access that particular facility. Do you have a way of measuring, like if a person comes and says, I need care, but I don't have money, do you have a way of identifying and really investigating to find out whether indeed this fellow is unable to afford medical care?
I will not go for that question. I'll go for the disease or how you are presented. Is it critical or not?
Okay.
I'll go by critical.
Okay.
I mean, if you have disease that will not kill you, wait. We don't have the money. We don't go get the money and come back. But somebody is lying down, as Dr. Kabu is looking at you. Within the next 10 minutes, you could die. The question of money doesn't come in. Let's take care of you first.
Right.
But if you can come and say you don't have the money, that means you're not die in 10 minutes. So that will not happen. So no, it's the only critical situation where this is applied. But the other one that the other company did was dialysis. Somebody may need emergency dialysis. Okay, so emergency dialysis, they don't have the money at the moment. Can you dialyze them? Who's going to pay for it? So that foundation also went for that.
Right.
So it's a seed money. So we hope to build on it, that, and sometimes what we do, it's not free. You give you the money, when you bring it back, you put it back where we took it from.
Right.
So it's not like free money, you can come and get it. No, it's a seed money for only emergency situation whereby you don't have the money with you, and if you don't do the intervention, you will die immediately or you die very soon. That is what we are looking at. Because if somebody can come out of that danger, then you have more time to talk about money.
All right, tell us about your dialysis center.
Most hospitals, again, I'm going to give you back to where I practice for almost about 25 years. Most hospitals have only 3 or 4, maximum 5 dialysis machines. Even a hospital like 1,000-bed hospital will have 4 or 5 machines. IMaH right now, initially we started with 5. Now we added 12 to it.
So we have 17?
We're going to have a total of 17. Wow. What's going to happen is 12 is going to be in the dialysis unit. We're going to put some on the emergency room.
Right.
We're going to put some also on the floor, and we're going to put some on the ICU.
Right.
So altogether, we have a capacity to build up to like 20.
Wow.
So we want
to you have 3 more to go.
Yes. So we will set it up, and it will be done, because so many people are dying because of dialysis. Okay. And the question also, maybe next time you come back and talk about what causes kidney failure to be on dialysis.
Sure.
Most of them we cause it ourselves. We actually cause it ourselves to get there. If you don't take care of yourself, you die. And you get your kidney failure. So that's another topic. But no, these are the things that IMaH is doing. We just want, when you come into IMaH, before you leave IMaH, we give you what you need, what you deserve. Because it's something that we have to work hard and get it. And that is the goal for IMaH, and IMaH is doing very well for that.
Awesome. All right.
I just want to add something. The dialysis is 24 hours.
24 hours?
Yes.
Oh, yes.
Like, okay, so at any point of time in the day, 1 a.m., 2 a.m., you reach there, you're able to, wow.
Because we try to suit patient care to individuals. Somebody wants to come for dialysis at 2 a.m. So we'll find...
The fellow doesn't want people seeing that he's...
So we have 24-hour dialysis.
Yeah, right. Wow. That's awesome. Great. All right, so tell us attitude towards COVID. And now you can even see it people are not adhering to the protocols, even though, there's been a resurgence, there's been a surge in some places, and, the Ghana Health Service is on air, announcing that, let's get back to the way we were when it first broke in 2020. But people seem not to budge.
I agree with you, but the thing is, how people have lived with it for 2 years. People are tired.
Yeah.
But in our facility, we still encourage hand washing, wearing your nose masks. All our clients, we encourage them to vaccinate or top up their vaccinations. If they already had one, those who've had one, two, we ask them to go for boosters. And all our clients with chronic illnesses, we follow up and make sure their vaccinations are up to date. Because if you're hypertensive, we don't need COVID coming into the situation to make things worse.
Yeah.
But with the national policy, it's only banks and other few institutions I find.
No mask, no entry.
Yes,
I wanted to ask you whether you think that it's a good thing we go back to it.
I think that would be the barest minimum. Just nose masks would be okay.
Right. Okay, Doc. So tell us about the quality of professionals, human resource at your disposal at IMaH.
Well, IMaH is one of the hospitals that I know has a lot of specialists there, and we do have them. We're still looking for more because a hospital, you can never have enough, because as much as we get in the specialists, you want to have the super specialists, and that's what we want to get, all the super specialists there, because the client that we serve, some of the clients, as we stated earlier, their expatriates come with the special needs, so in that case, we need them. In terms of specialists, like Dr. Cabo is here, he's an emergency room physician. Even though, yes, she's the head of the COVID, team, she still runs, the emergency room physicians. We have the family physicians, we have the physician specialists, we have the cardiologists, we have the neurologists, neurosurgeons. So we do have quite a number of physicians, specialists that we have. But we still need more. We want more. And I think if we are going to get the one-stop shop, then you believe with me that we must have all the specialists available in Ghana. Even if we don't have in Ghana, if it's out there, we have to get it, because Ghanaians deserve better, and I think we can have them to care for people.
Right. In our previous conversations with previous executives of IMaH, they gave us the impression that IMaH, it was the first of its kind in the West African sub-region, premised on the maritime component. I just want to find out from you, can you expatiate and tell us why this is, and whether you actually agree?
Yes, I do. Because where we're situated, we are just next to the sea. Ghana has three main entries. We have the, airports, which serves the airline industry. We have the land borders, who serve the inland flows, and then the sea. Also serve the seafarers and, those coming in from that transit. Now, IMaH is situated in a situation whereby if somebody is sick in the deep sea, in West Africa, where should they go? We have the Nigerians, we have the Togolese, we have the Ivorians, all the way to, Liberia, Senegal. Where should they go? Okay, so we think that I might believe that if anybody is sick in the deep sea in the west coast of Africa, they must come to Ghana and they must come to IMaH. And yes, we are receiving so many people in the deep sea when they get sick, even when they get COVID in the deep sea, they call, or if God forbid something happened, in the deep sea, they always come to Ghana. One, Ghana is safe, as we all know, among West African countries, and Ghana is also one of the best. Ghana in general has one of the best medical systems in West Africa. Therefore, the people in the deep sea would like to come to Ghana. So IMaH is just right there. Okay, that though when you get to port is very good at that. They have a clinic at the port to take care of people immediately. And once you leave the port, we have the port clinic, a GPHA clinic, which is also there to serve the need of the people. And then if you get sick, you come back to IMaH. So it's a 3-step process that GPHA has put in place. The port clinic, which is situated right in the port, which has an ambulance, and then they do have the GPHA clinic, then also the IMaH hospital to take care of them. So it's something that they thought about it, and I think they actually put their money where their mouth is, and they put out such a beautiful hospital to serve their needs. Not only the seafarers, also the people in Tema, Sakumono, Ashaman, whole Accra are also welcome to IMaH to serve, to experience the culture of IMaH health service.
Yes. All right. So one of my colleagues just sent in a message reminding us that FIFA at some point showed interest to use IMaH for the MRI to test the age of players. What has happened to that deal?
Well, if I can answer that,
yes.
FIFA, but if I don't know if I can mention companies or whatever, I don't know if I'm allowed.
Yeah, sure.
Yes, not only FIFA, but as you know, next year there are going to be Olympic Games. Okay, in Accra here.
Yeah.
So they also approach us, to use the hospitals. Some embassies, I don't want to mention any names, have also approached us. We actually seeing some. We have a collaboration with them.
Right.
And the most important thing that we also have mentioned is the helipad.
Right.
We have not used the helipad as much as we want it to be, because if somebody's in deep sea, you want to, take them straight to the hospital.
Yeah.
We have provision for that,
Right.
but that has not gone through yet because we're still with the civil aviation department to clear things out. So very soon, once we finish the civil aviation regulations, we should be able to have
the helipad will be activated.
Yes, we'll be. In fact, they have come. They looked at it. There's some things we need to do,
right.
And then we are still in the process of doing it. So that will serve. That is a game changer. If you can lift somebody from any other West African
from oil
countries,
fields and mining fields straight.
Straight there. It's an amazing thing what is happening in IMaH. So our goal, our task, is to have the vision come to pass,
right?
And within a short possible time, and I think we can do it.
And so what you are telling us is that you have that equipment that can determine the age of a person, the actual age of a person.
Actual age of the person. Well, if you don't know your age, then you'll find a machine that will tell you.
Okay.
But for now, we first ask you how old you are first, and then we'll take it from there.
Great.
But guess what? Nothing's impossible. I think we are working towards achieving the great goal.
Okay. I'll come to you, Doc. When I come, I would want to find out from you. IMaH seems to enjoy a lot of patronage from the expatriate community. We just want to find out from you, what is it that has made IMaH so attractive to the expat community? But this is our import viewers, and tonight we're discussing the contribution of IMaH, that's the International Maritime Hospital, to the fight against COVID-19. And we are zooming into some of the services it offers and why it stands out as an international hospital in our country and in the sub-region. We're going for a quick break. When we bounce back, we'll continue the discussion. Please do stay with us.
Every now and again, Goil makes good things happen. This time, Goil has introduced Super XP Ron 95, a higher grade fuel loaded with additives and yet sold at the same price as normal fuel. Goil Super XP Ron 95 enhances engine performance like never before. It maintains the engine by keeping it clean from carbon deposits. Goil Super XP Ron 95 is designed to burn slowly and thus improves fuel economy, making you save money after several kilometers. Goil Super XP Ron 95 gives you a smooth driving experience, that is, less vibrations. Fill up with Goil Super XP Ron 95. Now there's no need to pay more for any higher grade fuel. Goil has that sorted. Goil, good energy.
Electricity, then pay your taxes. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Impressive factory. If only I had listened to you, I wouldn't have been in this mess. That devastating fire virtually wiped out the whole factory and my warehouse.
Remember my misfortunes last year? Serene Insurance Asset All Risk Fire policy that I took were there to pay for my damaged stocks in the warehouse, and my machines that were affected by the floods have been replaced. My accident vehicle is back on the road thanks to Serene Insurance motor policy. Currently, my goods are on the high seas, covered with their marine cargo insurance policy. I was just telling Ajima about Serene Insurance.
Oh, Ajima,
tell him more.
As a road contractor, I make sure I do my contractors all risk insurance for the projects and then workers' compensation for all the workers on site. With Serene Insurance, they will make sure they will cover your unknown tomorrow today.
Serene Insurance, a new face of insurance. Call us now.
MPS Terminal 3 is Africa's new state-of-the-art container terminal at Tema Port. For manufacturers, agro-processors and traders, the new port means business can be done faster. This infrastructure boost will improve Ghana's port handling capacity, connect more trading routes, and oil the engine of growth for the economy, creating greater opportunities across all sectors as Africa's markets merge and become the largest trading bloc globally. MPS, we connect, you thrive.
All right, so you're welcome back. Pretty shortly, we shall be activating the phone lines for you to call in and contribute to the discussion. And we'll also be going to the mailbox pretty shortly to take your messages. This is Iron Port here on Metropolitan Television. In the studios with me, Dr. Akwesi Champong. He's the Chief Executive of the International Maritime Hospital, IMaH. And also in the studios, Dr. Barbara Cabo. She's an emergency physician and head of the COVID team at IMaH. We're discussing the contribution of IMaH to the fight against COVID-19 from 2020 till date, and also some of the services that they offer and why IMaH stands out amongst its peers as the preferred hospital in our sub-region. Let me come to you, Doc. I said I was going to ask you why IMaH seems to be enjoying a lot of patronage from the expatriate community in Ghana.
I think it's more from the fact, like my boss said, it's a one-stop shop. Mm-hmm. You get everything you need at one location. And there have been situations where we don't have the particular specialty or drug, but we'll go get, we'll get the help in. We don't refer. Yeah. And that is what is like making them more comfortable. And we also have staff who can speak a multitude of languages. We have doctors who speak Chinese, people who speak Russian, and a bit. Some of our secretaries too are bilinguals and stuff like that. So
that's a total advantage.
Yes, so they can communicate.
Even Spanish?
Yes.
Oh, wow.
They can communicate. And usually that's always a big thing about expats. If they can't get their problem to you, it gets frustrating. Yeah. But with IMaH,
they feel comfortable.
Provide, yes. And like my boss said, to the buildings and accommodation-wise, the infrastructure is more pleasing to the expats. So that's what brings them.
All right, so Doc, walk us through your collaboration with the Ministry of Health, the Ghana Health Service. You know, these are agencies you can't do without as far as delivery of healthcare in the country is concerned. What's your relationship with these organizations like?
Yeah, Tema belongs to...
like a private, public,
Well, as you know, IMaH is a quasi-hospital. We are owned by GPHA, and by GPHA is owned by government. But we also belong to Tema West Municipal or Health Services. We group the one good thing about Tema West, let me tell you, that they have all the hospitals, the facilities, the clinics into one umbrella. That we meet, regularly. Dr. Brimpong, Brimpong is the head. So we have collaboration with them. So yes, IMaH belongs to them. We belong to the group. So any information we relate to them, and they help us significantly. Right. In terms of Ghana Health Services, we go by their regulations. Ministry of Health, we go by their regulations. Everything that they ask us to do, we do them. So it's something that they've been very helpful. Since I took over, anybody that I approach or call, they are open their arms to help us.
Right.
Remember, they are here to help us. These are the regulatory bodies. They're not here to shut you down. They're here to make sure that you are doing the right thing.
Right.
I even called the boss of HEFRA, Dr. Bano, for questions that certain things that I didn't understand. He walked me through it. So they have been excellent relationship. And because we have provided a service that they're expecting us to provide. So yes, they've been very good, and I think it's a good collaboration with them.
All right, let's go into the inbox. This one says, "Good evening, I am Port. I have been to IMaH before, and I can attest to the quality of service they deliver." This one's from Maxwell in Michelcam. This one says, "Good evening. Can you find out from Dr. Champong when exactly he believes that the helipad services can begin in earnest?"
Cannot begin?
Can begin.
The issue is this.
That's coming from Alex in Takrady.
Yeah, it's an aviation issue. They have to come and see the environment, the people around the area. Because having helicopter coming in, it makes noise. So these are the issues that they have to assess. How much noise we're going to generate, how often, it will come in. And not only that, is your helipad is acceptable internationally. You have the good regulations. They have to look at the airflow coming in. We are by the sea. Can the sea air influence, the flow of air? So all these things have to be done first, and then something that they give it a whole list of things.
Right.
They came twice. They have come once. So they told us to look and correct the issues that they asked us to do.
Right.
One of them is like the wing socks, which we didn't have the wing socks. Which wing socks is whereby it tells you the direction of the wind. Okay, because for plane to land, it has to be guided by the direction of the wind. So all these things we have to put in place first, and that is what is holding us up.
All right, so I just want to find out from your side, in case you get a clearance, they're all clear, the green lights from the aviation authorities, and they give you the go-ahead to start. On your side, are you prepared? How are you going to be able to receive patients that come, land at the helipad, and then transport them to the various wards or where they are destined to go?
That is Dr. Barbara's side.
Yes.
I can answer
Emergency.
for that, but she's here, so let her answer that.
The helipad has a ramp that leads to one of the entrance to the emergency. And we have very good, paramedics and EMTs who are very able to do. I think maybe they would just need some retraining on how to approach the landing vehicle.
Okay.
Apart from that, taking the patient off the helipad to the emergency is something easy.
Okay. It's not going to pose any challenges, and you are poised. Once they say you should start today, you're going to be able to deal with it.
Please.
All right. My production team tells me I can activate the phone lines now, and the number to dial is 020-552-8353, 020-552-8353. You can call in and contribute to the discussion. You can ask the doctors in our studios whatever question boggles your mind, and I'm sure they will be able to provide some answers and solutions. Now, this one says, ask Dr. Barbara what they are doing. Are they really prepared to take on emergencies that comes in from the port? Because most of the port areas are operational zones, and accidents there are so many. What are they doing? If you can.
I didn't get the question.
The fellow is saying that the port area is an operational zone and accidents are there. And so what are some of the things you are putting in place, measures you are putting in place to be able to contain in case there are emergencies coming from the port, accidents happening in the port and the people are brought in?
Oh, it's not put in place. But things are already in place.
In place, yeah.
But we've gotten multiple of cases that have come from Cocoa Board, their compound, shipyard, GPHA itself. We do get cases that are here, and we have very competent doctors. At the competent emergency nurses, and like I said, our wide variety of diagnostic tools at the radiology and at the lab helps us. It's not something new. Since we opened IMaH, the first year was a bit sketchy, but now most of the companies, especially those who work in close contact with GPHA, know of our existence. So they come. Just as I'm talking, yesterday I was at work.
Right.
They brought somebody who had an accident at Unilever. So they do know and they do come because they realize that sometimes if it's not severe, they may not get to us. But when push comes to pull, they always find IMaH because they know we'll give you the best care, excellent care in times of emergency or trauma.
Great. Okay, so let me find out. We had the opportunity of covering a donation from a grateful family whose patient was there, and they tout the services, professional services that were rendered to the patient. Unfortunately, they lost the patient, but they were grateful, and they went and they came and then made a donation of some equipment to IMaH. Doc also mentioned the fact that somebody walked in and put some money down, seed money, to take care of emergency cases and all that. IMaH seems to be attracting a lot of goodwill from the generality of the people. Why is this? And what will you tell people who are willing to lend a hand?
The care we provide goes beyond medicine. Like I said, with our COVID patient, when you go home, it doesn't end there. We follow you up. All your concerns about going home is addressed. If you need a home care nurse, even though we don't offer that services, we get a company that offers, like we try to help you out. The extra bits we do, I think is what is bringing a lot of goodwill.
Right.
Because like I said, I sat in medical school with other people and they're working at other hospitals. But I'm not sure they get those kind of goodwill. It's the extra bits, customer service. Going the extra mile for the patient. It usually helps. Because like I said, you may take care of somebody's relative, the person may die, but the relatives saw the effort you put into trying to help the person. And I think that's the next stage of medicine, adding a human face to medicine.
Right. Great. Doc, tell us some of the other services you render that you haven't mentioned yet. I know you have a lot of things that you want to do at IMaH.
Well, one of the key things what Barbara
just mentioned,
just mentioned. There was a situation whereby a gentleman was discharged from the hospital. He was supposed to have come back for the review. He didn't like the hospital. He hates the hospital, so he didn't want to come. But here you are, somebody needs to follow up. He needs a blood test, he needs medication. He doesn't want to come back. So what we did was we actually sent a doctor, a nurse, and somebody to draw the blood at his own comfort home. Okay, so we follow him up without coming to IMaH. We send somebody there, took care of the patient and everything. You know, it's costly, yes, but there's something that, you know, IMaH chose to do, you know, because the family, you know, was also would prefer, but, you know, father has been seen, but the father doesn't want to do. So we decided that we have to do that. The other thing that we're coming up is that why should somebody keep coming to a hospital if the person can't come? In the COVID taught us something, that actually somebody can be home and they can see the patient at home on the phone or telemedicine or telehealth, and you can do that. Why don't we go back to the same thing? You know, why should somebody come to you every month for medication, whereby, you know, they can call, access the service that they need? So this telehealth, we are looking at it critically, that can we do it? Somebody may not be at Tema or Accra, maybe somewhere that also we need is our service. Can we look into that? So these are the things that we are actually looking at. And the most important thing is what in the next few years to look at IMaH, as much as IMaH is. Okay, as much as IMaH is, can we make IMaH as education institution so that whatever IMaH has, we can also teach other doctors?
All right, hold it there. When we come back, you will continue that. But let's go into the phone lines and welcome Nana, who's calling us from Sakumono. Good evening, sir.
Hello, please, my name is Nana.
Nana, yes. Good evening.
Yeah, good evening.
Please shoot.
Yeah, please, I was at Maritime Hospital some time ago, and I was asked to go to the lab. And the way they received me at the lab, I just want to say they are doing a very good job. And so they should continue with the good way.
Great. Thank you very much indeed, Nana. We are grateful. In fact, my heart actually leaped when I thought she was going to give some bashing, but that would have been in order so that, you take feedback. But we're grateful to you, Nana from Sakumono, for telling us what your experience at IMaH was when you went there some time ago. We're grateful to you. You can also call. The number to dial is 020-552-8353. You can contribute to the discussion. With me in the studios, Dr. Akozie Champong and Dr. Barbara Cabo, Chief Executive Officer and Emergency Physician and Head of COVID team, respectively. We're grateful to them for joining us. Doc, let me come to you. Yes, you were on turning IMaH into a teaching hospital. So Kolebu say you are rivaling into.
No, Kolebu is a different world.
Right.
They are our godfather, so we cannot compete Kolebu.
Absolutely.
I mean, I have to take my heart out for them. I mean, I see, you know, I have for GPHA,
sure.
So I can't compete them.
Absolutely.
So we without intent to. We are just here to augment what the system has.
Sure.
UGMC is an excellent facility. It's a coordinated hospital. Other hospitals, they are all doing marvelously well. Ghana population is increasing, so all hands on deck system that we have. So we actually want to learn from Kuala Lumpur because they train specialists for for the country. So I'm looking to collaborate with them. Let them teach us what they have, and then we can actually be better because we cannot do this alone. The other thing that we also have introduced is that a survey. If somebody is discharged or somebody comes to IMaH, we will email you by, I think we start next month. We will email you or send text messages to actually tell us how good or how bad we are. So we can actually improve on it. So when the survey goes to people, I'm appealing to people to just do the best we can. I know we don't want to, complain to anybody, but we just want to assess our service, assess our doctors, assess our nurses, even assess the facility. How do you see facility? Even the painting, is it fading? Anything.
Right.
So when we come there, we will say, when we receive the survey, please just check it out.
Whether they give you 2 stars or 3 stars or 5 stars.
Yes, it's important for us that we can build on it. We are learning. We just want to do the best for Ghana.
Absolutely. All right, let's go on to the phone line. I'm told John is on the line. Good evening, sir. Hello, good evening. Hello, John. I think we're having problems with this line. Maybe he can work it out and reach us again and contribute to the discussion. Let me come to Dr. Kabu. I don't know whether you are the right person to take this question, but you mentioned earlier that IMaH manufactures oxygen. You sell to other hospitals or other facilities. And I understand there was a plan, to export oxygen from IMaH. What's the status of this particular plan?
Well, I think I'll take that. Because actually, Ghana needs oxygen. I think it's about time that we have to look at, we have to take care of ourselves first, before we take care of others. No matter how much oxygen you produce, it's not enough for Ghana to use. So no, at the moment, even Tema alone needs a lot of oxygen. Ashama needs it, Sakomano, needs it. So we have not exported, but we will still, do the best we can, and then give it to other hospitals as much as they need it.
All right. Okay, let's go on to the phone lines and see if we can welcome Enyonam from Teshi. Good evening, Enyonam.
Good evening.
Great.
Grace, how are you?
I'm terrific, by His grace. Thank you very much. Please shoot.
Yeah, I even sent a message through WhatsApp, but I don't think you've seen it.
Okay.
I want to ask a question. And my problem is, I want to ask if maybe the person has already taken the vaccine, and the person have had the COVID again, and although she's been treated and become negative. So in this case, what should we do?
What should we do?
She have even taken the booster.
The fellow has taken the booster.
Yeah, I've already taken the booster.
And gotten the virus again?
Yes.
Okay,
but she's been treated.
And it's testing negative again?
Yes.
All right, so what advice would you prefer, Dr. Kaiwo?
My advice would be to see a physician, to go through your immunization, that is the vaccine, how it was taken and all those things. It could be that maybe the vaccine wasn't stored well, so it's not effective, or after the vaccination, the patient assumed there's some protection, not 100% protection. So if you assume 100% protection from the vaccine, and there's only one chance, and you play with it, you of course get the virus again.
Yeah.
So that is what, you just have to go through and see a doctor, and the doctor will take you through his health profile and the vaccination profile to figure out what went wrong along the line.
Okay. All right. Good evening, George. I understand we have you on the line.
Yes, sir. Good evening.
Good evening, sir.
George.
Yes, sir. Yes. Please shoot, yeah.
I was admitted there. I actually came there to do... Hello?
Yes, George, we can hear you.
Yes, I was admitted there. I actually was there for a surgery at the male's ward. One thing I felt uncomfortable was at the male's ward, the female nurses were big were bathing us, so to speak, like they will use the towel to clean us, and I felt it was a little bit uncomfortable. So
the female nurses were using the towels to clean you, the male patients?
Yes, at the male ward on the second floor. Yes,
Okay.
and I didn't like the whole thing, but if they can look at that one, apart from that, their services is excellent.
Top notch. All right. Thank you. But George, so that's something somebody
can I
what
say
somebody is
something?
praying for. What you are rather. Thank you very much indeed for that was just on the lighter side. Thank you very much for your call, George.
First of all, we have a large majority of female nurses to
Yes.
male nurses.
Yes.
So the chances that you get a female nurse
Yes.
is way higher.
Than
It's
getting a
only in the
male nurse,
emergency whereby I have more male nurses.
Right.
But for the rest of the hospital, there are more female nurses.
nurses, yeah.
Somebody will actually want to get an admission because of what he's complaining about.
Yes. Now, who that's a yes, Obama show. I will say. Anyway, George, please forgive me. That's on the lighter side, but I bet you that's what somebody is praying for. A patient will deliberately go there.
But I think what
because of what you have said.
what he can do the next time, just request.
Yeah, sure.
But
That
if
you're not
once you
comfortable
request that,
with
we'll
the
just make-
female nurse, yeah.
Yes, please.
With the female doctor or nurse, yeah.
Let me jump in a little bit. One of the things that what I've seen in Ghana that we don't complain when we need to.
Yeah.
We think that if I complain, they will mistreat me. Maybe yes, that could be true. But IMaH, no. Right. You have to complain because a situation like this can easily be resolved.
Right.
Just make a request
Yeah.
that I don't like this, and it will be changed.
I don't feel comfortable.
Even if the person, if you tell the nurse that they still insist on it, we always say they go to the next level.
Mm-hmm.
Okay, if you come to me or go to any of the managers, we will change it immediately.
Yeah.
Because remember, we are here to make you comfortable. We are
Yes.
here to ease your pain.
Absolutely.
So this can easily be
But
done.
feeling comfortable alone is a part of the healing process. And so if you don't feel comfortable, it means that your chances of recuperating quickly may be jeopardized.
If 50% of treatment is not medication.
Psychological.
No. I can actually give you water and tell you this is medicine. And you believe it, you'll be healed.
Yeah.
But if I tell
It's a
you...
mind thing.
Yeah, many of them are like that. But if I give the same medicine and I'm arrogant, my attitude stinks, you don't believe me.
Yeah.
You won't trust me. The medication will not do anything for you.
Absolutely.
So that's aspect of it. Even though the medication is a good medication, because of my attitude, because your unbelief with that can affect it. So we have realized that. So we need to make sure. So the gentleman concern is very, very good, but he should have at least voiced it out.
All right. So Robert in Techiman says, please ask the doctor from the emergency department whether they have a unit for sickle cell and how is it performing?
A unit.
Well, they take care of sickle cell patients.
Oh, we do take care of, I would say, all emergencies, whether sickling or not. But we've not had, mostly they go through the pediatric emergency if they are below 12. But the ones we've seen above 12, they are doing quite well.
Okay.
And we sometimes offer the telemedicine option for them because we really don't want a sickling who is not in crisis to come to the hospital.
Right.
Because you can come and pick up infections that will worsen your plight. So we do offer that to our sicklings who are stable in the house. We'll follow up on them.
Okay, so I just want to find out from you how effective your children's ward also is. You just mentioned the fact that sometimes you take care of kids that are 12 and perhaps below.
We have an amazing pediatrician, and now we actually even have a pediatric surgeon on board with us. And they have all the incubators, the phototherapy machines for children born with jaundice and all those things. And the incubators for the premature babies. And currently, the pediatric unit is equipped to handle very severe pediatric illnesses. So the pediatric department is actually up and running.
Yeah.
So if there's any pediatric cases out there, you want to come and see our amazing pediatrician, you're always welcome. If it's a pediatric surgery case, one is on standby to take care of you.
Right, right. Doc, so you mentioned the collaboration you would want to have with Kolebu in terms of turning IMaH into a teaching facility sometime. Somebody wants to find out how soon this would be.
Oh, we already started talking with the Ghana College, a physician and surgeon, concerned about that. When we went, the director was very nice, very open-minded, very helpful. and hopefully he will guide us through. And then I think it's something that is doable. As to when has to start, I don't know yet, because we just spoke to them at least about a month ago. And in fact, they actually also invited us, to talk about it. So I think there's a positive collaboration there. So I think we can get it done.
Okay. All right. I understand we have Dr. Bright Baston on the line. He's calling from Tema. Good evening, Doc.
Yeah, good evening. This is just a quick response. I would like to give you a bit of correction about my name. My name is Brian Buxton.
Okay. Brian, okay.
Yes.
Okay.
Yeah.
Right. Thank you.
This was just a quick question. I would like to know about IMaH and their contribution to all the maritime agencies and sectors in this country concerning the health of all the agencies and sectors which are maritime related. Talking of Ghana
Maritime Authority, Ghana Shippers Authority. Yeah. All right.
Regional Maritime University.
Very
and all
clear.
That. What benefits do these agencies gain from IMaH? That has been my first question, and always I have been on this to find out from them what has been the benefit that they deliver to some of these agencies. Thank you very much, sir.
Thank you very much indeed, Doc. We are grateful to you. Yes, just a quick one, because we have barely 3 minutes to wrap up. Barely 2 minutes indeed.
Yes, we do have collaboration with Ghana Shippers Authority already, and Ghana Maritime Authority as well. So that has been. And if I can borrow one of your 3 minutes, one of the key things that IMaH wants to do is the hospital. To me, is a misnomer, which means that you wait until somebody gets sick before you go to hospital. IMaH want to change that. We want you to come to us for annual physical, to prevent you from getting sick. So if you are 30 years old or 40 years old, the things that you need to do for 40 years old, male or female, we are pushing for that.
Right.
If you are 50 years old and you're male, you never had a prostate check, you never had a colonoscopy check, all these things are what we are promoting. So we want to promote good health, good living, than you getting sick. Because the Ghana, life expectancy is just about 62, 63%. I mean, 63, 64. Okay, as compared to even Jamaica. Jamaica has 75.
Okay.
If you go to any European country, it's 80. The difference is that people do go annual checkup. So that's what if time will not allow us, I will go through it.
Yes.
But we need people to get.
We actually don't have time.
Right. We want people to get preventive medicine than disease relief medicine.
Right. Okay. All right. So I think this is how we draw the curtain on Iron Port here on Metropolitan Television. Much thanks to Dr. Akwesi Champon, Chief Executive Officer, International Maritime Hospital, and Dr. Barbara Cabo, emergency physician and head of the COVID team at the International Maritime Hospital. Tonight we've been discussing the contribution of IMaH to the fight against COVID-19 and some of the services they have to offer. You heard them, and we're grateful to you, those who called in and those who sent your messages. We're grateful to you. Remember, the average version of the show is aired on Ghana Television every Wednesday at 8:30 p.m. God willing, next week we shall bounce back with another wonderful edition of the program. Many thanks to our sponsors, Ghana Revenue Authority, Goyle Company Limited, Serene Insurance, Ghana Link, Meridian Port Services, and indeed Ghana Ports and Harbours Authority, who have powered the show. My name is Kennedy Mona. Much thanks to our executive producers, Madam Esther Gibi Donko and Nana AC Soderberg. We are grateful to you, and next week we'll see you again. Thank you.